Good afternoon, Coach Kelly here with a very special guest, James Heptig with Willow Chiropractic. Um, I've invited James on my corporate wellness show to learn more about what he does and how he serves his clients. We actually know each other from Lifetime North Dallas, where I'm a fitness professional and James is a member. And I'm just excited to see what we talk about this afternoon, and how that might add value to your efforts. So, James, before we jump in, do you want to add anything?
Yeah, I guess I'm a chiropractor. I've been a chiropractor for almost 25 years in the Plano area. So yeah, we just help our patients any way that we can. So open to questions.
All right, here we go. So, why chiropractic? I mean, why chiropractic versus other options in the medical field? I mean, what drove that decision initially?
Yeah, so I was always interested in the medical field, in the healthcare field, I should say. I was an athlete in high school, I was an athlete in college, I played football, and I was always really interested in a more natural way to go about things. If you are injured, there are drugs you can take, but that may help you feel better, but that doesn't necessarily make you get well or get better. Where with chiropractic, you're working on the whole musculoskeletal system, you're working with the nervous system, to accelerate healing and actually promote healing, not just masking things with medication. So I was just more drawn to the healing aspect and the natural side. I was always into exercise and nutrition, and so chiropractic kind of goes along with that.
And seeing that was going to be one of my follow-up questions, is because he and I have been around each other for a number of years now in the gym. I knew he was passionate about his fitness, so that had to have played some role in influencing you to want to do this in the first place.
Absolutely. Again, always into exercise, always into nutrition, taking care of the body, getting the body to function more optimally. That's kind of what chiropractic does. It's kind of what exercise and nutrition do. That's how it's more philosophical, the way I got into I have a good friend. He got into it because he was in a car accident. He used to compete in martial arts and was unable to do that anymore. Was going to the orthopedist, and they really just said, you're just gonna have to give it up. He went to a chiropractor got him right back on his feet, back competing again. So he has a real cool story how I got into it. Mine was more philosophical.
It is interesting though, because I just use my my general practitioner as an example. I struggle with my sleep. He just wants to offer me sleep meds. We've gone through several and none of them helped, as opposed to trying to find out, okay, what's driving the problem in the first place. Let's address that. But that's not, I think, the mentality of the typical doctor. They are more, here's a drug, as opposed to being proactive in finding the cause.
Yeah, that's right. And medicine has its purpose, but yeah, when their prescription pad is like, well, why are you not sleeping properly? Not just, here, take this medication to make you sleep. And those medications don't put you in the right state of sleep. They don't give you the quality of sleep that you need anyway. So dig deeper. Why are you not sleeping? Figure that out, and kind of address that, rather than just take something to make you sleep.
I agree.
Or if you have pain, just take something to take away pain. It doesn't really solve problems.
So that's a good segue. So I have worked with a couple of chiropractors in the past. The one guy was it ART?
Mm-hmm.
So he did ART on me, and then another guy that did Rolfing, I think is what it's called.
Mm-hmm.
So what else do you do besides chiropractic? Do you do anything else besides?
Yeah, I do. So those are great soft tissue techniques. We do a lot of soft tissue techniques, myofascial release, that kind of thing. But a lot of what we do is adjusting the spine or adjusting extremities if it's a shoulder problem or something. And when you adjust the spine, not only are you fixing the mechanics of things to get things lined up properly and moving properly, but your whole nervous system flows through the spine. Obviously your brain sits up in your skull, sends signals down. So when you adjust people, you're just putting in a body in a better state of health. Your nervous system is better able to regulate. So back to the sleep thing, I had a patient, and she was coming in here. She had insomnia, flat out couldn't sleep at all. Didn't tell me that. She was here for a neck problem. So I started adjusting her, and she comes back and tells me, you know what, I sleep through the night now. I didn't tell you I had this problem, and I do. And so it's not something I treat, but when your body is lined up properly and your nervous system is functioning properly, a lot of cool things can happen. So,
and this is not a question on my page, but this is just spontaneous. How often should the average person get adjusted? How often do you get yourself out of whack that you need to come back in?
Yeah, so answer might vary from practitioner to practitioner. I get adjusted once a week always. Really? Life is stressful, like mechanically stressful, looking down, especially a lot of people, office workers, looking down at technology. A lot of people don't have very good posture anymore. So, on a weekly basis, I find misalignments that need to be corrected in my own spine on a weekly basis. I really tell my patients don't go longer than every 4 weeks, like once a month. But a lot of the research shows if things are really stuck and not moving within 14 days, the degenerative process can start. So really, it shouldn't be longer than 2 weeks.
Wow, that is interesting. So give me a favorite client story.
Let's see. Well, the insomnia one was pretty cool. I've had people. This one guy, I literally had to carry back into my office. He bulged a disc in his back. He couldn't move. I literally carried him back here onto my table, and he was able to walk out normally.
Really? Now, what'd you do for him? I mean, how did you? Because I've had a herniated disc about 12 years ago, and I went through physical therapy. What did you do to help him?
So, the main thing we do to help is the chiropractic manipulation, the adjustment. To work on getting pressure off of that disc, to get pressure off of that whole entire area. So that was the main thing. Did some soft tissue work, again, to encourage that. We did some spinal decompression, which is a form of traction, which kind of takes pressure off of the disc to level 1, up to level 2, back. So it's called imbibing the disc. It really kind of helps stimulate that disc to help that disc recede and to heal. And with all those things, he was able to walk out.
That's an amazing, and obviously no surgery.
And no surgery.
So what is the biggest misconception that people have about what you do?
They think, chiropractic, it's all research-based and evidence-based, but a lot of people say they don't believe in it. There's nothing to believe in. We have the research, the governments have the research, independent studies have the research. So people think we're just like, it doesn't work, we're just popping them, or just whatever. But, they don't understand that everything we're doing is based on research and it's based on science.
So it's real.
It's real.
I know it's real.
There's no belief system. It's real. Exactly. It works. And if you talk to people who have never been to a chiropractor, they might say, well, I wouldn't go. It's scary, or I don't believe in it. Well, everything we do is extremely safe. Our malpractice insurance is minute compared to the medical profession because everything we do is so safe. And people who have been to a chiropractor, 98% of them will say that they've had a positive experience and it helped them.
Do y'all use like taking x-rays or even MRIs as a part of what you do? Or
we do. Not every person. If you just slept funny and you had a crick in your neck or something, you might, but we do have x-ray machines here. We do refer out for MRIs when necessary. So we do imaging when necessary. Not every single person who walks into the office will necessarily receive imaging.
Okay. What makes you feel the most inspired about what you do?
Just getting people to get back to the things that they love, right? Getting to help people, whether it's something, real big or something small, like, parents can't sit on the floor and play with their kid because their back hurts too much. When you're able to give them that, or, go out and play golf or play tennis, if that's something that people like to do, just restoring that, it seems like a little thing, but it makes a big difference in people's lives. So I just like to help people.
So this is kind of so as a fitness professional, people hire me to help them, and yet one of the problems that I run into is that after a period of time they think that they can run on their own or do it on their own, and they don't really give me a chance to help them long enough to see a big difference. Can you relate to that in what you do? That can be frustrating. I've had patients who I know that I can help. They just have to give me some time because they're serious, injuries. And, they might come in once or twice and say, well, I don't, or just disappear, like, oh, it wasn't really working for me. But I know that I could have helped them if they would have followed through with the treatment plan. Some treatments, a couple treatments, and you're better. Some, it might be several weeks. It might be, a month or two. And it is frustrating when you can help someone, but they don't want to receive that help, and they disappear. I agree. What's the best compliment you ever received? That's pretty open-ended, but yeah, that is. I have a lot of really great patients who always, well, I had one patient, for example. He lived in Plano. He was from England originally. He moved back to England, was over there, hurt his back, been to medical doctors over there, I've been to therapists over there, I've been to chiropractors over there, and nobody was able to really help him. So he flew back to Plano and stayed in a hotel for a week. And I worked on him every day and got him fixed up. And I would say that's a big compliment, flying overseas just to come see me. Yeah. Best advice you've ever received? Best advice is probably just, kind of stay true to who you are and what you do. Don't try to
just be you, basically. Don't try to do things that are out of your comfort zone or that you're not comfortable with.
And I mean, you've been doing this for 25 years, so this is
Yeah, I'm very comfortable.
this is what you do.
This is what I do.
So, how would your family or friends describe your career, what you do as a chiropractor?
My wife would say I work too much. But everybody, I adjust them all. I treat, I guess one of the misconceptions about chiropractic going back is that, if you don't have pain, you don't need to go. It's kind of like if you don't have a tooth pain, you don't need to go to a dentist. It's good for everybody, right? Chiropractic is great as a reactive, like fixing problems, but it's even better as a preventative. If you keep your spine healthy, keep your spine aligned, keep your musculoskeletal system working properly, you can often prevent a lot of those injuries that people come later on. So all my family, with or without pain, they get adjusted on a regular basis. So they've seen my practice grow. They've kind of see it. So they're all pretty happy for me.
Kind of like why we go and get our teeth cleaned every 6 months. I mean,
exactly.
It's just...
you clean your teeth. You change the oil in your car. You do these things as preventative maintenance. Same thing.
Okay. This is a little different question. If you could have dinner with 3 people, past or present, combination thereof, past as in not with us anymore, right, who would you pick?
That's interesting.
Kind of fun question.
Yeah. I think Michael Jordan will be one of them. Just his competitive nature and just watching him play and all the things he do, I think that would be pretty awesome. This may or may not be popular, but I might pick Donald Trump. Whether you like him and agree with him or dislike him and hate him, I think he exposed a lot of the problems with the world and our government. So, and then maybe like some kind of ancient philosopher.
Okay.
I couldn't pick one, but yeah.
Fair enough. And then, what advice would you give to your 20-year-old self? That was a few years ago.
Yeah, it was a few years ago. Just work hard, stay at it. There'll be tough days and there'll be good days, and just overcome the tough days and keep pushing, keep working.
So, I learned a couple of things, but especially on the preventative side, because I had no idea the frequency of how someone would need to get adjusted. I can only imagine that someone like me, who lifts weights 5 days a week, we might need adjusting more often.
Yeah, so it's kind of funny. There's a balance there, right? People who are super, super active need to get adjusted regularly, but a lot of my patients, they're sitting at their desk all day long. Gravity is a constant force pushing down on us. So if you're not aligned properly, leaning forward, like you're causing a lot of tension and stress and misalignments in your spine. So a lot of the people who sit all day are really the ones who need it more than anybody.
So that was my previous career. Before coming here, I sold commercial office furniture, but my last job, I was a manufacturer for an ergonomics company. I mean, I have almost as many credentials in that as I do fitness. Mm-hmm. And what he just said is really true. If you put yourself in a constant posture, like hunched over a computer all day long every day, it's literally like pouring your body into a mold, like baking cookies, and you pour them into a cookie mold, and over a period of time your body will take on that altered shape. That's not how your spine in particular, that's not how it's supposed to be. That can mess you up big time. And so I understand what you're saying.
Yeah, that's going to cause pains and problems, but that's going to cause degeneration to start as well. Now
really?
your spine is under undue stress. If you have a bowling ball on top of a stick and you hold it like this, it's really not that strenuous. You lean that stick forward like this, and now that bowling ball wants to go. Now it's straining your arm. That's what's happening to your spine all day as your head is forward, as you're looking down at things. Gravity's constantly pushing down, so it's putting a lot of strain and stress throughout your entire spine, your neck, your back, everywhere, and that's going to lead to some degeneration potentially in the future.
Okay. So any final thoughts for them?
Just be healthy. Go to the gym, use your trainer, go to the chiropractor. Eat well. Food is just fuel for your body, right? So if you fuel it poorly, your body's going to run poorly. So eat well. I'm a big fan of taking supplements. Our food supply is not as nutritious as it used to be, so I think you have to supplement as well. But those and stay hydrated, of course.
Well, James, thank you very much for your words of wisdom.
Thank you.
Thank you, sir.
All right, Killer.
All right.